So how do I, Dr. Allo, and many other cardiologists decide what is your risk and who needs to be considered either low risk, medium risk, or high risk? So first of all comers, no matter what, if you're young and healthy and have no other medical problems, your LDL needs to be under 100. That is without question. If you have one risk factor, let's say you're a male over 45, a female over 55, male sex in general, you have hypertension, diabetes, you have a family history of coronary artery disease or any peripheral artery disease, any atherosclerosis, you have, other factors, that we might, like you have a bad diet, you don't eat a lot of fiber, you don't exercise, you're sedentary, you're overweight or obese, all that kind of stuff. If you have one single risk factor, then your LDL probably needs to be under 70. If you have multiple risk factors, I would say 4 or more, you're like a ticking time bomb. You are guaranteed to have atherosclerosis at some point. Your LDL probably needs to be under 60. We know that 60 milligram per deciliter is kind of the cutoff where people start to build plaque. Above 60 milligrams per deciliter, most people are building plaque. Below 60 milligrams per deciliter, proven by multiple studies, which I've gone over, generally most people are not building plaque. If you have more than 4 risk factors, and you also have lipoprotein A and kidney disease and all of this, then you are probably considered one of these super high risk categories. The guidelines generally don't recommend you be under 40, but if you're one of these super high categories and you've already had a heart attack, you've already had a stroke, you've already had some kind of atherosclerotic cardiovascular event, then those super high risk people definitely need to be under 40, especially if you have lipoprotein A.